Recording. Yay, we're now recording. So welcome everyone and anybody else who comes in at any point. If during our conversation, we're so excited to have Rachael joining us to talk specifically about the health aspect of leading through this crisis. If you have a question or anything, you can let me know that in the chat, or we may pause and there may be gaps. You can definitely jump in or wave at us and we'll give you attention to try and allow you the opportunity to ask your question and be a part. We want it to be as interactive as we possibly can. So we'll start with just a little bit of fun. Rachael, tell me a little bit about yourself. So tell me about your family, about whatever you want to tell us.
So if you don't know my name, we'll start there. My name is Rachael and I am from London, Ontario. I did not grow up in London, Ontario. I kind of grew up all over the place. I went to 10 different schools growing up. So I went to a lot of different schools, just 6 elementary schools in that time period. So kind of grew up all over the place. Originally from Alberta, moved to the States for a period of years, from North Carolina and then to Florida. If you want any stories about Florida, Wayne would be happy to tell you those stories. I kind of just grew up in a bunch of different places. I come from a family of 6, so I have 3 other siblings and my parents, and my whole family is very medical. I always call myself the gray sheep of the family because I'm the only one that's not a doctor, but I'm a nurse, so I somehow weaseled my way into the family. My father is an oncologist, and then all 3 of my siblings are, one's a surgeon, one's a family doctor, and one is an internist. So we kind of just pick the whole spectrum. You're like, we'll just open a hospital and it'll be fine. But I would never work with my siblings because that would be terrible. Love them, it would be terrible. So we're kind of a very medical family. And then about, I guess it's 4 years ago now, I kind of clumsily stumbled into ministry after feeling called since I was 7 years old. But like I said, my family is very medical, and I was raised in Alberta and then the southern United States. And so women in ministry wasn't a thing. And so I didn't really know that was something I could step into. So fast forward to about 3.5 years ago, I started to 5 years ago, I started to kind of lead different ministries at the church I attend now, which is Gateway. And then from there, God just kind of pushed me further into ministry, and I started Bible college, and then eventually 3.5 years ago, we planted Gateway Western, which is where I am the campus pastor now, and that's been going really well. And so we've been growing, and I've been kind of navigating what that looks like to be a bivocational pastor, because like I said, I'm also a registered nurse. So I have been a registered nurse for 5 years, and the first 3 years of my practice, I was working acute medicine, which is basically overflow emerge with a particular lean to mental health. And then for the past 2 years, I've been on OB, which is a completely different world, but it's been a lot of fun. And I'm trying to raise up an army of children that are named after me. It hasn't worked yet, but we'll get there. It's one day at a time. So that's kind of a little bit about me and my family and where I'm coming from, and just a little, each true Hollywood story of my life. And yeah, you're welcome to ask any questions or wonderings.
Nice. So tell me this. What is your favorite part of ministry? Like, you're a pastor, but you also do nursing. What's your favorite part?
My favorite part of ministry, that is a loaded question with, I feel like, a million different answers. But I think I always say I have one vocation, 2 locations, because nursing and pastoring are very similar careers in that you are meeting people in dark times and you're walking them through situations. And my favorite part of that is seeing people, like, the light go on and that people get it, whether it's like, they finally realize that Jesus loves them no matter what, or that there's people that care about them, like whatever that light may be, that aha moment. I love moments, and I have that there's this trust that people have in you that they wouldn't normally have in just like anybody, and they're immediately able to share the intimate details of their life, which is pretty, I feel very privileged to be in those moments with people. And I love that I get to be in those privileged moments, whether it be in ministry or in like a healthcare setting, just to be able to step into intimate moments of people's lives and just get to, you know, be a part of that. I love that.
That's good. So just a couple of fun things just to help, you know, keep things light and whatever. What is your favorite movie you've seen in the last 2 years?
Okay, everyone is gonna roast me for this, but I don't care. I loved Frozen 2. Like, it was a spiritual experience for me, I swear. Because when they're talking about the next right thing, I was going through a period of my life that I was like, oh my goodness, this is like the Lord speaking to me through Frozen. And so Frozen 2 has like a very deep meaning to me. And I know that everyone's gonna make fun of me for that, but that's okay. Because, sorry, my dog is just, so this is Frankie. You can get to know Frankie. Anyway, Frozen 2 is, yes, I cannot yet watch it without weeping like a little baby. And I can't put the soundtrack on in my car because I think it's considered distracted driving because I'm just like weeping in my car. So yeah, Frozen 2 changed my life.
The sound,
can we cut that out of the recording part? Or
for those who that are not familiar with the movie or don't even know any of the songs of the soundtrack, if you go and look what the soundtrack titles are, it is currently what we are living in right now.
It's prophetic, okay?
It's the creepiest thing. Like Into the Unknown, Lost in the Woods. There's like all these things.
That's hilarious. It's a real place. So like if you want to have yourself a good cry, then just listen to the Frozen 2 soundtrack. Yeah. But for cool purposes, is there, maybe someone could suggest to me a movie that I could have said that would make me cooler? No? Okay, that's fine. All right.
Beautiful Day in the Neighborhood. Let's just
Beautiful Day in the Neighborhood.
Yes,
Perfect.
with Tom Hanks.
Love it. Tiger King. Is that a cool response?
Oh my God.
Okay.
Nice. Awesome. Okay, last sort of thing, and then we'll dive right into it. What's your favorite kind of mint? Like for freshening your breath.
Oh, mint. I heard meme, and I was like, that's too many. I have too many.
Yeah.
Mint. I like, okay, again, another roasting opportunity. I don't really love mints, but I do love candy, and I will often use them as a dual purpose.
I was feeding
like a sour key.
Your Mentos addiction. I was feeding a comment for that. Okay.
R.I.P. So Wayne is referring to, I had a mild Mentos addiction for like 3.5 years of my life. And then I found out that I have celiac disease and that Mentos has wheat in it, just, you know, a little fun fact. But I would have at least 2 packs of Mentos in my purse at all times and just would like pop them like all the time. But not the mint ones, the fruit ones, because they're basically, you know, fancy Starburst, but
nice. Awesome. So I'm gonna let Joshua is joining us here. So let's talk a little bit. Why don't you talk a little bit about the virus and how it affects people, and a little bit. Our topic today is obviously leading through crisis, specifically looking at health things. And so what are some things, I guess, maybe that we should know? Like as far as how the virus affects us.
Yeah.
Go ahead.
So this is a big topic, and I think there's been so much messaging on like the news programs and even through churches and through healthcare professionals that you know about this coronavirus. So it's COVID-19. So the first thing I would say is that coronavirus isn't just one virus. So coronavirus refers to an umbrella term, actually a lot of different viruses, and we have been affected mostly by 3 of them. So there was the Middle Eastern respiratory virus that had an outbreak in 2015. There was SARS, which was 2003, and then now there's COVID-19. So these are all considered a coronavirus. And the coronavirus is just a term basically that when you look at the molecular level of the virus, it has almost like a crown effect, and they call it the coronavirus. So it's an umbrella term. So when people are saying that we've never encountered this before, it's true, but it's also not true. We have seen coronaviruses before. Viruses in general don't generally have a like a medicine that goes with them. So like when you get viral pneumonia, there's things that we can do to help support your like respiratory system, but there isn't like a surefire, there's no antibiotic. Antibiotics are for bacterial infections. So people are like, why isn't there no medication? Why are we being sent home without treatment? It's because there really isn't any treatment right now. There's just things to support you through the virus. So it's important to know that this isn't something that is, you know, completely unknown. We've never seen this before. Like it is in a transmission sense in our lifetime, but as far as like overall global spectrum, we have seen pandemics before. And I think that's important to know. I'm seeing a lot of like doomsday kind of things, which I can appreciate. This is an unknown territory and it's scary, but also pandemics unfortunately happen. So like you look at something like the Spanish flu or the bubonic plague in the 14th century, wiped out 2/3 of the European population. That's a lot of people. And so those are things that are considered pandemics. And the reason this is so kind of exploding right now is because we've never seen a pandemic in our lifetime. And we thought that maybe, you know, our advances in the medical system would have prevented this. However, viruses evolve, they can transform into things that can affect other things. So as far as like why this is so like all over the media and all the news, we've never seen this in our lifetime. Hello. So I got distracted because I saw somebody that I knew. Hello, Charles. So coronavirus. So let's talk a little bit about what it is. So we saw this kind of groupings of pneumonia in Wuhan, China. So you heard about that at the start. The first case started December 31st, I think. So that's why it's COVID-19. It like barely slipped into 19. And they saw this grouping of about 25 people with a pneumonia of an unknown cause. And then they saw it be traced back to this wet market in Wuhan, China. And so then all of a sudden this pneumonia started to spread at a rapid rate. And it had a mortality rate of about 3%. And at first we're like, oh, 3%, that's actually not bad. But that's actually a pretty significant number. If you think of 3 out of 100, or okay, let's look at, you know, the population of Canada. 10% is what, 3 million? And you look at 3% is, oh, math, 300,000? I don't know. That's a pretty, I'm not good at mental math, guys. That's a pretty significant statistic. But we saw this rapid transmission of this disease, and because it's spread by droplet/airborne, we'll get to that later. So it's this type of viral pneumonia that's affecting people, and more specifically, it's affecting the elderly and the vulnerable population. And when we talk about vulnerable populations, we're talking about people with comorbidities such as obesity, asthma, any kind of autoimmune condition, those kind of things. And I think what we're noticing is that there's more vulnerable population than we were particularly aware of. So we saw this rapid transmission. About 81% of cases are very mild. Some people don't even know that they've had coronavirus, to be honest. And then there's the 15% in there that is severe, needs to be hospitalized, and then a small percentage that it can lead to death. In cases like Italy and New York, we are seeing a huge spike in cases. And I think people are looking at Italy and New York and they're like, oh my gosh, this is like the end times. These are sophisticated health systems. Something that, again, I'm going on a huge tangent here, but we need to recognize is population density matters. So you look at a place like Italy, it's a very, very small country with 60 million people. That is double the population of Canada in like this tiny little country. New York City, in one city, there's 18 million people. That is half the population of Canada. So we may see the similar percentage, but we won't see the similar numbers in Canada. And I think that's an important distinction to make. Anyways, so coronavirus in general, how it affects people is that it's basically like an intense pneumonia. And so this affects people's breathing. And you're like, well, how can pneumonia lead to death? So if you're looking at an elderly person, somebody who is a vulnerable population, they're having trouble breathing, which then in turn leads to difficult oxygenation of vital organs, so your brain, your heart, these kind of things. And if you have a comorbidity that organ is already stressed out, and then you add that it's not able to get the oxygenation that it needs to function appropriately, you're going to go into multi-organ failure and then eventually death. For most of us, we have healthy immune systems. We have everything going for us. We're most of this 81%. That's a large statistic. It's mild. It will just basically feel like an intense cold or pneumonia, and it's that small percentage that's blowing up the news. Which it's terrible, and it's that's a lot of people that it's affecting. But I think in perspective, we need to keep this in perspective and look at facts and not just go with our feelings on this. So that is a really long way and complicated way of talking just about a brief synopsis of COVID-19. Does that make sense? Does that help? I feel like that was maybe not encouraging, but I'm encouraged, and I feel confident that we're going to get through this. And though this is going to be a really hard time in history, this will also bring a lot of good things, a lot of social change, a lot of healthcare change, and a lot of amazing things for the church. So I am encouraged as a Christian and as a healthcare professional.
It's great. It was a very balanced presentation of it, Rachel.
Good. I'm glad.
Very good.
You're muted.
You're muted.
It does give you a warning when you're muted eventually. Anyway, Rach, I was wondering if you could give us maybe a bit of a sense of, you're still working in the hospital, you're treating patients. Can you talk to us a little bit about what it's like as a frontline responder? What are you seeing? What's it like to be at the hospital at this point?
Yeah. So right now I'm working full-time at the hospital because the needs are so great in that we have, just on my floor alone, we have 22 staff members off sick. And so there's a small criteria for who gets tested. So that's a big thing here, is that we actually don't know the accurate numbers of who all has the coronavirus, but we have a huge need in the hospital for healthcare workers in general. It is a bit of a layered feeling, to be honest, working there right now. I feel an overwhelming sense of gratitude to be able to have a job and be able to serve in this way, because it is ministry. It feels like ministry. I'm getting to walk into difficult situations, support coworkers, support patients, all these kinds of things. So there is an overwhelming sense of gratitude that I feel. And I'm just constantly reminded of Colossians, when it says do everything unto the Lord. And I definitely feel that working at the hospital. There's an eeriness, though, I will say. Emerge is empty, which is a really weird thing, because people are using it for, who would have thought, emergencies. But what we are seeing in Emerge is an increasing amount of overdoses every week, which is not all that surprising, but I think is a little bit of a foreshadow of another wave of something to come. And as the church, we need to be prepared after this is over to begin to help people pick up the pieces of their lives, and to show that, the best is yet to come, and we're in this together, and all those kinds of things. Eeriness, because we are practicing medicine in a way that I was not ever taught how to practice medicine. So there's no such thing as an emergency in a pandemic. This is a pandemic protocol, in that emergencies have different definitions when you're in a pandemic. With that, you've probably seen on the news that personal protective equipment is a little bit of a hot button issue right now, and that we don't have enough as frontline workers. And for me, as somebody who works in acute situations with people so I work in OB, and for most people, oh, they're healthy women. Well, not really. They have suppressed immune systems, and we're also one of the only floors in the hospital that is still allowing one visitor And although they go through a screening, which is basically asking a question, do you have a fever? Have you traveled outside the country in 14 days? People lie because they don't want to miss the birth of their child. Totally get it. So we're constantly exposed to the public, and I have to be in a room for 12 hours with the same people, breathing the same air, all those kind of things. So PPE was a big thing for us, also because we can go from a birthing room to the OR in a very short amount of time. And if you have a positive COVID patient, you need to be donning a different kind of mask. So for us, we had been given 2 masks a day and 1 N95 a day. And for me, that has posed some frustrating situations because we're not allowed to take the mask off for 4 hours at a time. So no water, and they're really tight, and you know, it's a recipe for a good headache. And then when we take over break for 4 hours, we have to fold it up, put it in the bag, to our person. I appreciate that does nothing. Does nothing to control infection. Basically, I'm putting the virus in a bag, letting it ruminate over the whole mask, and then putting it back on my face. So it doesn't make me feel so great. Now, that's been an ongoing discussion with, you know, the hospital administration, and we're slowly getting some more PPE as administrative labor leans on the hospital, but that has proved to be a little bit frustrating, and I won't say anxiety provoking, but worrisome for frontline staff, because a lot of the people going off sick in New York and Italy are frontline staff, just because they didn't have the appropriate protective equipment. And providing your frontline staff with appropriate PPE is how you flatten the curve. And so that has been an eerie, kind of frustrating decision, especially because we've had a number of patients test positive for coronavirus, and a number of staff go off sick. So you're just kind of wondering about that. And then I think about, you know, taking it back to my family, and I've had to socially isolate, physically distance, and quarantine from my family. I actually don't even go to the grocery store anymore because I'm exposed consistently. And then I live with my sister, who's a surgeon, and she's consistently exposed. And so we had to quarantine from family, friends, everybody. And so it has, my life looks a little bit different, and it feels weird. But there's also at the hospital, I'll say this too before moving on, there has been an openness to spirituality that I have literally never seen in the hospital. It's actually incredible. I walked into a patient room the other day, and the patient's husband turns to me, and his first question is, "Are you a Christian?" And I was like, why? Because I was like, why are you asking me this? This is so weird. Like, my name is Rachael. Hi, I'm your nurse. And just stuff like that. Like, people are questioning. I had a conversation with a unit clerk for 2 hours about the faith and spirituality, and people are just really open during times of crisis to talk about God. And the medical system is realizing that there's only so much that we can do, and there has to be something else that we can lean on other than our own understanding. And for us as Christians, we can say, oh, that's Jesus, that's God. Like, even in times that we don't understand, in times we don't have answers, in time where we actually have zero control, who do I go for hope? It's God. And in the medical world, this is one of the few times in histories that we're like, we don't know, we don't have answers, we're kind of just waiting out the storm here. We as Christians can step up and say, actually, there is a hope, and I have a confident hope in this guy named Jesus. Let me tell you about him. So there is this balance of good and bad at the hospital, that it feels weighty to be there, and I am being thrown into situations I wouldn't necessarily be thrown into as a 5-year nurse. And so I'm having to do some mental work with myself, making sure that I'm processing, and making sure that what I'm seeing, I'm processing, and not just locking away. But overall, I feel grateful. I feel super, just grateful. I guess is an overwhelming word with my coworkers and everybody. And there is that bonding that you get when you get to be in the trenches with people that I wouldn't have necessarily had otherwise. Mm-hmm. It's a long-winded answers. I hope people are tracking them.
No, it's good. Most of us are nodding. So just from what you just said, I want to pick up on 2 aspects. One is maybe talk a little bit about how you're caring for yourself in this time, because you just talked about processing and that kind of stuff. And then secondly, a little bit of what do you think that our congregations need to hear from us right now, as far as like our students or our children that we're pastoring? What are some things that we need to be sharing with them?
Yeah. So for me, as far as what I'm doing for self-care, it's pretty much what I have done for the past 5 years, but a little bit heightened. And I think that is the piece that we need to be talking about as well, is that you don't throw out the self-care practices that you do. You just put a little bit more boundaries in place, a little bit more precautions in place for self-care around yourself. So for me, I'm continuing to exercise. That for me is a huge stress reliever in how I, get my happy endorphins on and those kind of things. And after a long day or a really stressful day or a hard day, for me, that's a great way to decompress. I have increased my time with the Lord because for me, something that I was talking about with somebody yesterday, it was a student at the school, and they were saying how they haven't been sober for a 24-hour period in 2 weeks. And I was like, that is a problem. But I had had a conversation with them about when this is all over and you are telling your children or your children's children about how you coped during the pandemic, how you face this, what do you want to say that you did? How do you want to say that you coped during this? Do you want to say that I met this with faith and during this time, I gained a deeper and more intimate relationship with Jesus? Or do we want to say that we cowered in a corner and we just kind of waited for it to all end? And I'm not saying you have to start a new business or you have to start a new workout regimen, but it really is about, how do I want to say that I coped during the pandemic? How do I want to say that I met this challenge in my life? We look at these great heroes of history, like people like Corrie ten Boom and Anne Frank and all these kinds of amazing people that met challenge and great, enormous adversity, like greater than the adversity that we're facing now, with faith. And they coped with it. They acknowledged that times sucked, that times were hard. They didn't shy away from the severity of the problem, but they met it with faith. And I was thinking about that in my own life of like, okay, having that in mind, with when I talk about this 10, 15 years from now, what do I want to say that I did? And so I basically model my self-care after that. And I start to exercise. I'm eating, for the first like week and a half of this, I just basically ate chips and candy, and I was like, oh, that's a problem, because it made me feel like garbage. But then I was just like, okay, I should probably eat a leaf or two occasionally. And so I've started to, have more healthy like eating habits and exercise. A huge thing for people will be routine. So this has totally yanked all of our routine out from underneath us. And so if you can have some kind of schedule to your day, because I know a lot of you were working from home, get up at the same time of the day, go to sleep at the same time of day, have breaks. Because I think one of the things that most pastors struggle with is work-life balance, and now you're working from home. So there is like zero work-life balance. Create a schedule for your day. Schedule in breaks, schedule times that you're done your work, because that will help you compartmentalize work and home life. And I've had to do that for the days that I'm at home working on Gateway Western stuff. I have to be like, okay, I'm working from this time to this time, and then I'm going to take a lunch break, and rather than it just bleed through your entire day. And then you're like, wow, I just worked for 15 hours, but was like semi-productive. So that's been super helpful. And then also I have a couple of people that check in on me regularly. So I've asked them to do that. There's maybe 3 people that regularly check in, and it's not like, oh, how are you? It's like, no, how are you really? How are you feeling? And I'm just super, super honest. I don't filter my thoughts. I don't put on my pastor hat and like, but I trust the Lord, I just have people that I can be really real with. And we just talk, probably like 2 or 3 times a week. I talk with those, just decompress. And I think for a lot of pastors, we're spending this time supporting other people, and that should be done, but there needs to be a balance of someone who also is supporting you and helping you through this as well. Because this is not like, not gonna lie, this is hard. Like, we're going through a collective, like I use the word traumatic very lightly. Okay. Like, people like it is a collective trauma, but some people are going to experience that trauma more heavily than others, but it is a collective trauma that the world is experiencing. And so we're going through this together. So don't negate that it is hard. And if all you, and I said this yesterday on a post I did, if all you do during this time is cope, that is okay. If all you do is spend time with the Lord and you do what you have to do to get through the day, that is okay. And I think for me, I'm unlearning that I have to do in order to be productive. But what God is requiring from us, and then that and do for others. And so I think that's been an important thing for me to kind of unlearn during this season. As far as like what people should be hearing from us, whether it be students or other congregation members, I think the book for this whole season for me has been the book of Colossians, which really focuses on the supremacy of Christ. And why that's been so important for me is because people, I think, need to hear that no matter what, still God is still in control. The church will still continue to expand. His plans have not been interrupted. They haven't been thwarted. They haven't been delayed. His plans for your life, all those canceled events, all those missed opportunities that you thought you had, and you're grieving those opportunities, God's plan for your life is still on track. And I think that's something that people, that I think has been an important thing to especially convey to students and university students, is that God's plan for your life is still on track. This isn't like a hiccup. This isn't a hiatus. That God is using this. And, you know, our lives with God doesn't start again after this pandemic. It actually is occurring right now. And God is using this to grow our faith and strengthen us and to develop courage and integrity and all these different kind of spiritual disciplines in our lives now. It's just whether or not we're willing to identify and recognize that. And so I think it's important for us to remember that God is in control, and again, I feel like a million people have said this, but he isn't surprised by this. It didn't, like, a lot of people have been talking about, you know, their weddings have been canceled and all these big opportunities that have been kind of interrupted by this. And that sucks. Like, it sucks a lot. But God, like, is gonna redeem these moments. And I really believe that everything that has been stolen, everything that has been interrupted, those moments, those times, those opportunities, I believe that God is going to redeem. And so just praying that into people who are maybe grieving a loss of an event or loss of an opportunity, praying into them that God is going to redeem those moments, and maybe in ways that you never expected. Like, for example, I knew and I believe that revival was coming to London in 2020. And I had all these expectations of what that would look like. And I was like, I saw churches be filled, and I had specific numbers in my head. And I was like, this is not really what I thought that would look like. But then I'm realizing that God is expanding the church, and God is exploding the church just in a way that none of us can take credit. Like, he's doing it through the online, in the privacy of people's homes, not through these big productions, not through these big experiences, but through small, intimate moments with him in their homes. And it's producing these authentic relationships with Jesus. And I'm like, oh my gosh, is this revival? Like, what? This is not how I thought it would happen. There's no stadium here. There's no like big preacher. There's just Jesus and a couple like pastors like talking about him on the airwaves, you know. But it's important to take notes of those moments and then to tell people about those moments, you know, the power of testimony. Share with your students, share with the people of the congregation how God is working things, miracles out in your life, how he's working out miracles in the lives of other people. And yeah, the power of testimony is going to be super important in this. So anyway, what was I saying? Who's to say? But that's kind of where I'm at, is of what it's important to share with people during this time, is that God is in control. He is sovereign. He saw this coming. He's going to redeem moments, and to take note of the miracles and the revival that are happening now, and not waiting till this pandemic is over.
Yeah, that's really good. I don't know if I'm muted. Nope.
No, you're good.
You're good.
I'm good. It's interesting that you mentioned that, because that is one of the things that I think as a church, we are having to adapt, obviously, to new ways of doing things, but recognizing like our faith, the foundation that is our faith, is not rocked by what we're going through. It is that having to persevere and trust in God, even in the midst of the chaos that is our life right now. That message of hope is so vital, coming from all of us to the people around us. You've talked many times, this is a bit of an aside, but you've talked many times on your mental health Mondays that you do, about the value of that, almost recognizing the positive and starting your day with, hey, this is okay and it's going to be good. I think that just echoes the same thing, and it's just that we can't get all downtrodden right now being like, oh man, we're losing out on all of these things, but instead focusing in on who God is and how he's going to bring us through this. So go ahead.
I was gonna say, I think it's an important, so if you guys have been tuning into the mental health chats with Elaine, we talked about 2 weeks ago, we talked about how during this time, it is possible to feel uncomfortable and be okay at the same time. We're not negating that this is a really hard situation and a really weird situation that we're in. And it's okay to feel uncomfortable, but also recognizing, like, I'm in the comfort of my home. I'm not sick. I have cupboards full of food. I'm okay. I'm safe. And so it's recognizing, in one hand, I can hold, I'm uncomfortable, this is a weird situation, and I'm safe, and hold them in unison. And rather than just being like, this is weird, this is the worst, the sky is falling, and going on this spiral, recognizing I'm uncomfortable, this is weird, this sucks, but also recognizing I'm safe, I'm healthy, I'm okay.
Mm-hmm. Sorry, I'm writing down the mental health chats with Elaine because I want to take it and put it as a link on our website.
Perfect.
And so I'm like just writing that down so that I don't forget. Forget.
And like, I think for all of you who are pastors and are kind of trying to negotiate this time or strategize, how to best care for people. Right now, other than prayer, there's nothing we can do for people's physical health. We can pray for them and all those kind of things. But one of the big things, and I mentioned this briefly before, is that when this is over, we are going to see another pandemic, and it's going to be of mental health. So, and again, I don't say this to scare anybody, but just so you can start to be proactive in your approach of connecting with people now in authentic ways. So we flattened that curve. So after SARS in 2003, the people that were quarantined, 65% of them in the year after experienced severe depression and symptoms of PTSD. So that's 65% of the small amount of people who were quarantined during SARS. And now we're seeing an entire globe that is being quarantined. Now our world looks a little different than 2003. We have more technology, more resources. We have a little bit more in our favor. And so I don't think it's going to be as high, 65%, but I still think it's going to be a significant number of people who are going to be experiencing depression and PTSD. And so a huge way that we can begin to mitigate that and be proactive now is maintaining real, authentic relationships with people, consistently checking in on them, encouraging them to do self-care, and promoting truth. And when I say promoting truth, I mean still doing everything that we should be doing during this time, like social distancing and washing our hands and not touching our face, because I trust the Lord, but I wear a seatbelt, I get vaccinated, you know what I mean? So still do those things. But promoting the truth that God's got this. This will end. It will end. I don't know when, but it will end. And that we are in this together. And if you have an anxiety or a worry about this, to talk about it. Talk about it with a pastor. Talk about it with a friend. Don't just shove it down and wait for it all to end to begin processing. Because I think that's a little bit of what's happening is everybody's kind of in survival mode and shoving down all these feelings, shoving down all these worries and questions. And then when this is all over, it's just going to go, and we're going to all of a sudden have all these anxieties and worries that we didn't deal with. So encouraging people to, what is making you feel uncomfortable? What is worrying about you? Let's talk through those things. And not from like a counselor. You don't have to be a counselor to do this, but actually just talking about people's feelings and how, and what is actually worrying you? Is it school, or are you worried that the chaos of your life is going to get out of control? you know, like just things like that. So I would encourage you to have authentic conversations and be real about how you're feeling. And I think for me, that's been a huge highlight to me for the church, is that people aren't looking for things that are particularly polished. They're looking for authenticity. They're looking for people to be real and for pastors to be real about their walks. And for me, like the first week of COVID was a chaotic week. And I really spun out of control because the first statistics that I heard brought me to my knees. And my entire family is on the front lines. And then knowing immediately that I'm not going to be able to see them for a significant amount of time. My dad is over the age of 60 and working on the front lines, and he has a heart condition. And my mind just went like this. And I was a mess. And I had this moment where I said, okay, this is the time that our theology and our faith is not going to be found, it's going to be revealed. How much faith do I actually have? Do I believe what I say I believe? And I had to take a step back and be like, okay, if I say that I trust you, God, when times were good, that has to translate to now. And I have to be able to give this to you. And so when you're talking with students or when you're talking with members of your congregations, tell your real story. Tell the moments that you struggled and then how you struggled out of that. Because no one relates to the person that's like, well, just from the beginning of this, I thought it was all going to be okay. And I had no worries at all. Like, people are like, well, good for you. Like I was a puddle in my floor listening to The Next Right Thing from Frozen 2. You know what I mean? Like people, like authenticity, I think is going to be the superpower of the church during this time. And I think this is an incredible opportunity to break down those walls of the church that people thought the church had. So a lot of people won't walk into a church because they're like, well, I'm not perfect. I'm not polished. I'm not, XYZ. So I can't go into a church. And now we have all these online experiences, so many open doorways for people to encounter the church and an opportunity to be like, yo, we're just figuring out this just like you. And I've wrestled with this. This is how I've wrestled. Maybe this will help you too.
That's really good. Yeah. So at this point, I'd love to invite anybody who has a question or anything you wanted to talk to Rachael about, or get a thought about, or an opinion, whatever. Feel free to just wave at me and we'll let you ask. But I'm only going to stall for so long. So yeah, any thoughts, comments, questions? Yeah, Nicole.
You were talking about how there's a great possibility of, sorry, my son.
Here's a question.
Of seeing another, pandemic with anxiety and depression and stuff. And that's something I've been reading up on, just as someone who is kind of prone to anxiety and things like that myself. What would you suggest as, even with us, my husband being a youth pastor, what we can even be doing with our students now to kind of prepare, for that? Because we were even seeing before all of this happened, we were struggling with anxiety, depression, cutting, like all of this stuff. So just to be kind of like guarded and armed with that, like what would you suggest that some practical tools that we can start preparing for that, or just know what to do?
Yeah, I would definitely say continuing the conversation. So I think for the first week and a bit of this, we didn't really know what to do, and so everything kind of was put on pause, including like conversations that you've been previously having. So anybody that had been currently struggling with anxiety, depression, self-harm, all those kind of, taken a pause during this time. Have those open dialogues with those particular people that are struggling, checking in on them and asking specific questions. How are you doing with your anxious thoughts these days? Have you been self-harming? Like actually asking pointed questions. You can have an open, authentic dialogue about it. So afterwards, it's not like I spent 2 months self-harming and I didn't tell anybody. You know what I mean? But actually, like chatting about those things open and honestly off the top. And then, yeah, I would just say continuing those authentic relationships, calling people. I know a lot of students are like, I've never called somebody before. And it's like actually calling them and like having a conversation with them, not just a quick text, because it's really easy to lie on a text, to be honest, but calling them, FaceTiming them, as real of an interaction as you can. And I'd say like start calling it out now. Like start to talk about these things. Like, I don't know if some of you guys do like Zoom call meetings with your youth groups. Start to talk about it now. Be like, you know what, this is a really hard time. And you know, if you're struggling with anxiety, depression, self-harm during this time, please contact me and I would love to talk to you about that. So I'd say, yeah, starting to get the conversation going now, because you know, we aren't counselors, we're not psychotherapists, we're not, you know, psychiatrists, and we have to leave that other aspect to them when this is over, but starting the conversation now, so you can act as like a little bit of a triage, or when this is over, you can get people to the appropriate resources within an appropriate amount of time.
Mm-hmm. Yeah, that's really good. Anybody else? Yeah, Brian.
Just for myself, like I love to not only like I'm a very like hands-on. I like to be busy. I like to do stuff. And I know I serve a congregation who's very much like that too, who likes to do stuff. What would you say to a local church who may want to serve a nearby hospital or a facility center where they deal with frontline activities?
Yeah, so there's a lot of different organizations right now that are kind of organized to do that. And I can point you in the direction of a couple. One of them is the Homefront.ca, which organizes people to help deliver groceries to quarantined healthcare workers, different like essential services that they require, and just having volunteers do that. So as far as the local church wanting to do it, and I see a lot of local churches so well-meaning and like just like flooding the grocery stores, and I was like, please don't do that. Please don't, like in groups of 15, go to the grocery store. But like going to organizations that can help organize those things and volunteering your time and your resources or your finances, those things are like incredible. Another thing that like people have started to do, which is honestly super helpful, is to create, to start sewing homemade masks and scrub caps. And I know we laughed at homemade masks for a long time, but this is a CDC recommendation for the general population, is that you wear a cloth mask when you're out in the community. And this isn't to protect other people. Well, this isn't to protect you, it's to protect other people. And I'll steal Justin Trudeau's, you know, line to stop speaking moistly on people. So you put on that cloth mask, and it just keeps you from speaking out to other people. So sewing those for the local community is actually super helpful, because it makes people not wear surgical masks, and so they can be donated to the hospital. So that is like a little bit of like the background information. If people are wearing homemade masks, like the layperson, it leaves the surgical mask and the N95 mask for the professionals that are working in the OR or in Emerge or any other acute setting that are at a higher risk of being exposed. So those are just a couple like examples.
It's good. Anybody else? While you're thinking of your questions, Rachel, how many rolls of toilet paper is enough?
Oh my gosh. Okay. So I found out why people were scooping up all the toilet paper, because I'm like, what is going on? I'm like, if you think you need that much toilet paper for a month, you have another health condition you should probably see a doctor for, because that's a lot of toilet paper. So apparently this actually stemmed out of Australia. When they had those bushfires, they get obviously all of their toilet paper imported, and when they closed everything for the fires, they ran out of toilet paper. And so when we had a pandemic come here, we're like, we're gonna run out of toilet paper. Look what happened in Australia. But we have a toilet paper factory in Brampton. Like, it is literally right there. And so you're like, we're gonna be fine. Use a normal amount of toilet paper. People who are getting like these like huge like fleets from Costco, I'm like, guys, like, do you have a problem you need to talk about? Like, I know. GI doctor.
Yeah. Nice. That's good. I was telling Nicole she got a play set for her kids. I was like, you should charge people. They can come and play on the playground in your backyard. You can pay for it. People are probably thinking the same with toilet paper, try and make enough money to, pay the mortgage while not working. It's fair.
Yikes.
Yikes is right. Okay. Anybody else with any other questions? Anything? Hopefully this has proved helpful for you. It's definitely been it's been eye-opening to me. I certainly appreciate Rachel for taking the time to be here and to share with us. So anybody else?
I'll just quickly say, as far as healthcare recommendations, because I know you're getting tons of different CDC recommendations and public health recommendations. The best recommendations for what precautions you need to be taking are from your local public health website. So whether that be for us, it's Middlesex Lund Health, or wherever you're from, going to the public health website, because if you go to somewhere like the WHO, the World Health Organization, they're going to give health recommendations for the entire globe, and my health recommendation will be different than Italy's and China's. So just make sure you're going to your local London Health, your local public health website to see what the recommendation is. But best practice, I will just say, healthcare workers none of us were we don't want to be heroes. Please, stop it. What you can do to support the front line is wash your hands, don't touch your face, and stay home. And this includes not going out, to visit a friend or to visit a student. This includes, only staying with people who live in your immediate household. That's what that means. So please stay home. And the best thing you can do to encourage, help frontline workers is encourage other people to do the same. Limit the amount of times you're going to the grocery store, limit the amount of times you're going to public places. This is just for a season. And this is not a doomsday thing. This is literally public health 101. Okay. This is just as simple as us saying, wash your hands after going to the bathroom. Again, I trust the Lord, but I'll wear a seatbelt, wash your hands, So those are the best things that you can do to support frontline workers. So something I read, again, tangent, but something I read the other day was that hospital staff are not frontline workers. We are the last line of defense. You guys, everybody at home, are the front line. You have the ability to flatten the curve, not us. We are at the end of it. We're in the curve. You have the ability to flatten it by staying home, staying with your immediate family, and limiting the amount of times you're going outside. Yes, and stop wearing N95s outside.
And should we just dispose of our masks, or not our masks, our gloves on the ground? Is that where we do that? I'm just kidding.
Okay, also, people wearing gloves in the grocery store, you realize that once you've touched something and touched something else, you've negated the entire purpose of the glove. So just don't wear gloves if that's what you're going to do, because you're going to need about 30 pairs of gloves for it to be effective. Nice.
Can you tell us that website again, the Homefront? Because homefront.ca, I think, is a real estate website.
It might be
Charles.
.org. Hold on, let me see.
I tried looking really quick, but nope. We're all secretly Googling it, and not secretly.
Yeah, pretty much. Boy.
Well, while you're doing that, I just wanted to mention that, Rachel, where can we find the conversations with Elaine?
On Gateway Western's Instagram page at 5:00 on Mondays.
Okay, so it's not they're not logged somewhere, or we can't revisit. We just got to tune in on.
They're saved on our IGTVs for I think 24 hours, and then we have kind of recaps within our stories and our feed. So if you miss the information, you can get the recap on the feed the day after, or you can watch the live.
Okay. Perfect.
So I think it's homefront.ca, but if you go to, there's an Instagram account. I'll just put, it's called the Homefront CA. That's the Instagram account. Oh, I think I just did that to Wayne.
You did. That's okay. I'll type it to Charles. No. So be at Homefront CA on Insta. Do it for the group. Awesome. Okay. Well, thanks, Cindy. Is there anything you wanted to weigh in at this point?
No, I think Rachel, you did great. That was so helpful.
Oh, good.
Thank you.
Awesome. And we are having one more conversation in our Zoom. We should have called it Zooming Through the Crisis instead of Zoom Leading Through the Crisis, which is Zooming Through the Crisis, which is what we're all doing anyway. But tomorrow we are talking with, right? We are talking with Kevin Joel Copeland. I believe that's how you say his last name. And he has experience as a children's pastor, but is also a registered psychotherapist. And he'll be talking about dealing with relationships and interpersonal relationships. Most of us are finding ourselves locked in our home with people more than we are used to. And so he'll be helping us navigate a little bit of that. And so we'd love to have you join us. As I mentioned at the beginning, we've been recording this conversation. We will make it available on the youthministries.ca website, and I imagine on the CFM website as well, just in case you wanted to rewatch the conversation and pause it at silly moments.
Can you Photoshop a different background for me? That I'm like at Big Cat Rescue or something?
Nice. Yeah, that could work. Yeah. No? Anyway, thanks. No, we can't do it. But thanks so much for joining us. Have a great rest of your day. And I'll stop the recording now.